to 75 degrees, maintaining their back flat, it's a 50% grade. If they can get to about 60 degrees, 60% grade. 45 degrees, and that's the easiest thing right here, you're going halfway. If they can get to about right here, 45 degrees, that's a 70% grade. Most people are really going to struggle to get much more than 70%. It's only the real fit individuals who are going to be able to go past that. Females, if they can get to 15 degrees, that's 100% for females. 15 degrees for males is only 90%. And 100% would mean that he's maintaining his back flat all the way down to the ground. And let me tell you, not too many people can do that. Alright, again, he has some tightness in his hip flexor on this side, so he's going to have some trouble maintaining this a little bit. So basically what we do is we get underneath, fingers underneath the lumbar spine. I say, alright, go ahead and flatten out onto my fingers, push down, come on, push, 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 push. And what I want him to do is try to relax as much as possible. You're going to get some compensation because they're going to tense up quite a bit. Try to use the rectus, as much as possible so everything's going to kick in. So we want him to try to relax as much as possible. You want them to try to breathe. People are excited. They want to beat you, whatever. They hold their breath. You want them to try to breathe. You don't want them to pass out when you're doing the test. So let's go ahead and press down, right here, press down. Right here, good, and relax. If you get someone who has a real poor understanding of pelvic control, they may not get it. So what I usually have them do is say, arch your back, lift up off of my hand, now do the opposite. Go down, press, come on, press, press, press. And he's working to do this, so this is going to definitely get him. All right, after they can do that, then you take their legs off the table, say, all right, same thing, try to press in my fingertips, come on. Press down, breathe, good. Alright, once they get a feel for that, then I'll take them right up into this position. Again, if they're super tight in hamstrings, this is going to be a struggle just to get up on here. But if they're super tight, it's also going to help them because it's going to force their low back down pretty quickly. Alright, now hold that pressure on my fingertips. Hold it right there. Keep your legs straight. Keep your legs straight. Let's go ahead and lower down, lower down, lower down. If it starts to come off, I say, okay, stop right there. Come on, press into my fingertips, press. If they can press, I'll let it go on. Go ahead and lower down, lower down, lower down. Stop right there. Press, come on, press, press, press. And relax. Okay. Just because the camera's on, I'm not going to tell what grade I would give him, but
not very good.
He is struggling to do this, and he's a pretty fit guy. But because of the tightness that we already saw posturally in his hip flexor, that's a major problem for him. Because I know his abs are actually pretty good. He popped right up on that sit-up test. But in comparison, his lower abdominals are really struggling. So posturally, I would start working on some of this flexibility work. Because the thing is, if we don't get that flexibility issue out of the way, his hip flexors are always going to try to dominate and try to overpower his abdominals. So you can't adequately strengthen if there are other things going on. You got to do it sort of all together, and for him I would probably clear that out pretty quickly. Okay, the Ober's test. This is one test that I almost always do. It gives me a lot of information, especially for patellofemoral issues. So if I have you lie on this side for me, okay? All right, come on back towards me a little bit. Right there. All right. So the traditional Ober's test, basically what we're doing, you can just lay down flat. You want to flex the legs up, give it a little bit of relaxation. I'm going to bring the hip forward, just get a little relaxation, lift him up a little bit. So I'm actually putting the muscle on slack that I'm looking for. I stabilize his hip. Otherwise he's going to start rolling back, not feel comfortable, and start freaking out on the table. So I stabilize his hip. I'm basically pushing his hip forward. I'm right behind the trochanter, just locking him in. Bring him back. I get a sense now. I have trouble even getting him to neutral here. His back is starting to arch a little bit. So again, those hip flexors are becoming a factor. So again, just by getting him in this position, feeling how tough it is for me to get to neutral, watching what his pelvis and low back do, he's pretty tight. Now what I'll do is say, all right, just go ahead and relax. Let this drop down. Let it drop. Ideally, this knee should drop right down to the table. I'm basically holding his foot right now, and you can see how tight he is. Now what this tells me is there's a lot of tightness here. There's a lot of tightness in this lateral structure. And that's going to be a problem, because if that is tight, now he's not going to be able to stabilize real well. There's going to be a lot of stress on the glute med, and surprisingly this test is very indicative that his hamstrings probably are not as strong as they need to be. Glutes and hams typically will go together. If he's very, very tight in here, again, it's going to have an inhibitory effect on his hamstrings. So glute and hams are indicated with this that he has a lot of problem. So I'm going to stabilize, bring him back, let it drop down. Now once I have him completely relaxed here, what I'll do is I'll actually push this in here, get a sense of how good his quad flexibility is. Ask the patient, okay, any knee pain? He'll say, no, I just feel it in the thigh a lot. Is it real painful? Not really. Or that's what hurts me. So you can tell right here. Most importantly, now I'll drop down. The knee is still sort of flopping away. I can just take this and I'll bring them out. Typically at about that 20-degree position that we talked about where the IT band is tightest. If they have significant patellofemoral symptoms, this is going to recreate their symptoms, because now you're putting this structure on maximum tightness, and what it's going to do is just sort of yank this kneecap out. It is not a pleasant feeling. People will tell you right away, it feels like my knee's going to pop, or that's very painful, and they turn around to look to hit you.